Sacred Heart Health System utilizes the CDC transmission-based isolation precautions in our facilities. The type of PPE or personal protective equipment that's worn will vary based on the level of precautions that are required for the type of isolation that is being used. We have standard precautions, contact precautions, droplet, or airborne infection isolation. You can use any of these isolations in conjunction with the other. The first isolation process that we're going to talk about is droplet isolation. There are specific masks that are used for droplet isolation. The first mask that you'll see is a regular surgical mask. It's the yellow mask with ear loops. The next mask that you'll see is a blue cone surgical mask. It has a single loop, but it does have the metal band across the nose that you can fit to your face. There is a third mask that you can tie around your head and around your neck. The next mask is a surgical mask that has a face shield attached. This particular mask that we're looking at has ear loops. This mask can be formed to your nose as well, but it provides protection for your eyes if you're doing a procedure with a patient that causes aerosolization. Then we move to airborne isolation. The mask that's required for airborne isolation is an N95 mask. This mask is identified with a special lettering that's going to be found on the mask that specifically states that it is a NIOSH N95 mask. It also has 2 elastic straps to ensure a tight fit to your face. These masks come in different sizes. If you are a person who is designated to wear an N95 mask, you will be fit tested prior to having to use these masks. You'll notice that these masks come in different sizes. This particular mask is slightly large for our model. You can see at the bottom that you have a little bit of a space where it doesn't fit tightly to her chin. You can also wear a face shield with this particular mask. So if you are doing a procedure with a patient that's going to cause aerosolization, you can have the added protection for your eyes. Next, we'll discuss contact isolation. What's required for contact isolation is a yellow isolation gown. This will have long sleeves and it ties at the neck and around the waist. Please be sure that you tie both ties so that when you're performing patient care, the gown does not droop around your shoulders. Gloves are also required for contact isolation. In most cases, this is all the protection that you require. If you're going to be doing a procedure with a patient that's going to cause aerosolization, you will also place a mask, you may place a face shield, and then your garb would be the isolation gown, the gloves, the mask, and the face shield. You can use this same combination with your N95 mask so that you have full protection. The doffing of the PPE begins with the gloves. The gloves are the most contaminated items that you have during the course of caring for the patient. So we remove them first and we dispose of them by dropping them into the garbage. And a clear garbage bag is all that's required for contact PPE unless you have blood on your gloves or your gowns. The next item that you remove, face shield. The next item that you remove is your gown. You untie the gown. You may actually have to break the tie. And then you roll it off your shoulders into itself, roll it up, and drop it into the trash. The last item that you take off in any sequence is your mask. If the patient is in airborne isolation, your N95 mask would be taken off either in the ante room or directly outside of the room. There's a second gown in the isolation cart that's a blue impermeable gown that's resistant to fluid. This one has a loop at the neck that you just place over your head. and it has thumb holds in the arms. So when you put your arm in, it's going to secure at the wrist, and then you're going to tie at the waist. One of the differences between this gown and the yellow gown is that it has an open back, so all of your uniform will not be completely covered. The next thing that you're going to don will be your gloves. So you'll choose an appropriate size. When you pull the gloves up, it will come over the sleeve of the gown. And you'll notice that you can see how the thumb hold keeps the gown in place. In your next step, put on an appropriate mask for whatever procedure that you're going to do if needed. So if it was in a droplet isolation room, you would put on a surgical mask. If it was an airborne isolation, you would put on an N95 mask. The process for removal is the same as it is for the other PPE that we discussed. You start with the gloves. They are the dirtiest piece of your PPE. Those peel off. You run your finger under the second glove so that when you pull it off, you're only touching the inside of the glove. The outside is contaminated, and then that is dropped into the trash receptacle. The next thing that you're going to remove is this blue impermeable gown. You'll untie it, and you shrug your shoulders so that you are able to use your hands only on the inside of the gown because the outside is contaminated. And roll the gown to where you're only touching the inside of the gown. Remember that the outside and the front of the gown are the most contaminated. And then drop it into the trash receptacle. And then the last step of removing any PPE before you leave a patient isolation room is to perform hand hygiene.